Hi guys, this is Dr. Nita with Keys of Health. I'm back with an update on coronavirus. It has now been named COVID-19, that is COVID-19. At this point, COVID-19 has been declared an international public health emergency. Wuhan, the epicenter of the outbreak, has been under lockdown for approximately 3 weeks now. Many countries around the world have had cases of human-to-human transmission of the virus as well. So is this the new pandemic of our times? It's hard to say, but it's moving fast and it doesn't look good. So does that mean we have to panic? This is what I want to talk to you about today. Panicking is not going to do anything. It will not help. So far, there have been over 1,400 reported deaths related to the new virus, and the official numbers of infected people around the world have surpassed 64,000. At this point, World Health Organization's chief has noted concerning instances of infection among people who have not traveled to China. The virus has spread to approximately 28 countries, but the vast majority of the cases are still concentrated in China. Even though human-to-human transmission has been reported, but it's fairly early to say how contagious the virus actually is. It takes months, if not years, to figure out the actual statistics of the damage it can cause. The virus is deadly depending on where you are. If you are in China, you have a seriously high risk of contracting the virus. But if you are in, let's say, US, the risk is minimal because only 12 cases so far have been reported in the US among the population of 330 million. That doesn't mean you don't need to be cautious. Be cautious, but don't panic. Before I talk to you about what you can do to protect yourself, let's talk about the symptoms. The symptoms of this virus are very similar to your average cold, dry cough and fever, and in some cases it leads to pneumonia, kidney failure, and even death. But as long as you have a strong immune system, you're all right. You can fight this off, just like any other virus. Most of the people who have died have been either elderly, children, or those with underlying medical conditions. At this point, at this moment in time, the doctors are not sure how deadly it is, but what we have seen so far is that most healthy individuals have recovered. So this brings us to the point, how do we stay safe? Before we talk about it, let's talk about how we can contract the virus. We know that the incubation period of this virus is anywhere between 2 to 14 days, and even more, according to recent reports, before the infected person starts showing symptoms. Doctors are suggesting that during this period when people have no visible symptoms, they can still be carriers and pass on the infection to other people. However, World Health Organization has backed away from this claim recently, so it's still an iffy situation. But it doesn't hurt to be cautious. There are things you can do to keep yourself and your family safe. First and foremost, stay away from crowded places. Don't travel overseas unless absolutely necessary. This is definitely not a good time to be taking international vacations. There is a gentleman who has been named the super carrier. He traveled from China to the French Alps where he passed on the virus. Then he went somewhere else and passed on the virus to other people. And he actually is responsible for transmitting the virus in 2-3 different countries. So this is why you want to stay away from international travels in case you come across a carrier. Wear a mask if you're going to be in crowded places or will be in contact with sick person. Instead of a regular surgical mask, wear an N95 mask. It looks like this on your screen. N95 masks are going out of the market, are going out of stocks very quickly. So make sure that you procure enough for yourself and your family. It's a good idea to have it handy, especially if you're going to be traveling or in crowded places or in contact with sick people. Another thing you absolutely must do is clean your hands, invest in hand sanitizers and antibacterial wipes, wash your face, and clean out the inside of your nose 3 to 4 times. So sniff the water and let it run off 3 to 4 times a day. Make sure your children change their clothes as soon as they get back from school or play. Talk to them about the virus and importance of keeping themselves clean and avoiding to touch surfaces, any surface unnecessarily, be it walls or any other surfaces. Sure, you don't want to raise anxious people, but it is never too early to teach healthy habits to kids. Aside from external protection, increase fluid intake, focus on strengthening your immune system, take vitamin C, vitamin D, iodine. This will increase your immune system, give you ability to fight, and help maintain the healthy status of mucus on the lungs and keep them well hydrated, which helps protect lungs from infections. You definitely want to increase citrus fruits in your diet, like take immune boosting supplements such as grapeseed extract, echinacea, ashwagandha, mushroom blend, and there are so many more. Look at what is available locally in where you are, and you will find tons of stuff. Take teas like hibiscus or a blend of spices such as cardamom and clove and cinnamon and star aniseed. They are amazing when taken together. I will share the recipe with you on Instagram and Facebook. You can find immune boosting foods depending on where you are. So don't limit yourself to what you're hearing from me. Educate yourself on what is available locally around you. If you're near a beach, take advantage of that. Take a walk on the beach for an hour and you will get all the minerals, including iodine, that your body needs. And when it comes to your diet, avoid dairy, meat, chicken with hormones. If you buy organic milk, make sure it still specifies that it is hormone and antibiotic free. Excessive hormones are a killer for your body in general, but it's really damaging for your immune system, especially when you have a new virus that is out there that your body needs to be prepared to fight. Realistically speaking, stay away from people who have heavy cough and fever. I am not encouraging you to be rude, but you want to be cautious while still being polite. If you develop a cough or fever and feel lethargic or have other flu-like symptoms, don't wait for more than 3 days and go to the nearest hospital. If, God forbid, you or someone you know contracts the virus, make sure you stay away from elderly, young children, and those with chronic conditions. It is our collective responsibility to prevent the spread of diseases. Do your part. Keep yourself informed. I will keep you posted with further updates on the topic. We can hope and pray that it passes like other coronaviruses before without further damage. Meanwhile, like the video, subscribe to my channel, and make sure to share the video with your friends and family. Take care. I'll see you next time. Goodbye.